So next, here's what we want to do. Our goal is to knock down the rates of this infection by taking smart, common sense measures that we know that works for the next immediate future to knock these numbers down low enough so that the hospital admissions get low enough not to jam our hospitals. So what I'm going to share with you is a graph that will show what we believe is a realistic prediction of our ability to achieve that goal. So let's put the slide up, please. Now, this slide, and I'm going to spend a minute on this to make sure people can understand it. This slide shows the predictions, the projections of the hospitalization rates that we will experience in the next several weeks. The gray area is the range of the projections, from the very optimistic to the very pessimistic. The red line that goes down as it goes to the right, as you can see, represents the midline, if you will, of the projected hospitalizations on a daily basis that we will have in the upcoming several weeks. Now, obviously, what we want to do is to get that red line down low enough so that we can avoid our hospitals getting jammed. Now, you'll see a horizontal line also. Is it green or blue? I can't see it from here. It's blue. That line represents the level of daily admissions that we believe is safe to get down to a level that we will be able to maintain our hospitals in good shape. So what we want to do is to continue our efforts to reduce infections to get down to that low line. And where those lines meet, frankly, is the magic point where we believe we will be safe to be able to eliminate some of our common sense measures that we know have worked, including masking. So now I'll show you where those lines meet, are very close. So you'll see the green vertical line. This is March 21st, and basically it is very close to where those lines meet to show when we project we will be in a position to be able to reduce some of our requirements and therefore save our hospitals from being overrun. And obviously, we're headed in the right direction. Okay, we're done with that slide now. So considering these best projections based on the best science, the best epidemiology that we have today, and best on what is good for Washington State, we are confident that we will be able to reach a level by March 21st well, we can remove the requirement to wear masks in most of our situations. So we will be removing the mask mandate in our schools and in our public indoor spaces as of Monday, March 21st. That means on March 21st, we will no longer have a state mandate for wearing masks in schools. And on March 21st, we will no longer have a state mandate for wearing masks in indoor spaces. We think that's a very important step in the next part of our journey to normalcy. Now, there are some places where masks still will be required in healthcare settings, in outpatient, dental, long-term care, and correctional facilities. Obviously, that makes sense because these are places where people are very close together and have a lot of vulnerable people who are associated with healthcare delivery systems. We should note the federal government has their own requirements that include transportation, which still do require masks, and that includes in buses. So obviously that is a federal requirement. We can only control the state. So the good news is we are approaching a place fairly shortly where we will not have to be wearing masks generally in these conditions. And we think this is both good for our health and our education of our children and the total reopening of our economy. And we should be very pleased with the progress we have made. And I want to thank Washingtonians who have put us in a position to be able to make this progress. We are in a position to be able to make this progress because people have been careful, have by and large followed our mandates, and have been responsible, and most Washingtonians have got vaccinated as well. This is what has allowed us to be in this position to reduce these mask mandates.